tested for tick-borne diseases. Recent state data finds the ER sees more positive cases in July than any other month. Here to tell us more is Dr. Daniel Kritzkes, Chief of Infectious Diseases at the Brigham. Great to see you, Dr. Kritzkes.
Good to see you, Erica and Ben.
All right, Dr. Kritzkes, so this report only looked at patients who showed up in the emergency room with symptoms, so it doesn't include folks who may have gone to their doctor or clinic. But at your hospital, how common are these tick-borne diseases right now?
We see a lot of tick-borne illness starting in the late spring and continuing all the way into the fall. You know, interestingly, our new infectious disease fellows just started a week ago, and many of them are from out of state, and they're just amazed at the variety of tick-borne diseases that we have here in New England.
Yeah, not something we like to brag about,
No.
for sure. Many people in this area have heard about Lyme disease, of course, but what about some of the others in Massachusetts? Which ones should we really all know?
Well, there are three major ones. Lyme, of course, is the big one, but also an infection called anaplasmosis and another one called babesiosis. Babesiosis is sort of like malaria, usually a lot milder, and it's found here in New England. And anaplasmosis is a parasite that infects white blood cells instead of red blood cells, so kind of like malaria of the white cells. Anaplasmosis usually resolves on its own, but it, like Lyme, responds to doxycycline. Babesia can be more serious in some people.
So as you know, all tick-borne diseases can cause fever and chills, but frankly, a lot of illnesses can fit that description. So if someone is bitten by a tick and then they have some kind of symptoms, at what point should you really kind of seek medical care here? And how do you connect it back to that tick if it could be, a couple of days or a week later?
Well, if someone has a tick bite, and particularly if the tick is latched on for 24 hours or more, we actually recommend providing prophylactic doxycycline to prevent tick-borne disease because it's so frequent. But if you had symptoms of fever and chills and sweats, and if they persist for several days, then that is a reason to go and be tested. Even though doxy will treat both Lyme and anaplasmosis, it won't treat babesia, and that can be an important diagnosis to make.
Use that repellent and keep your arms and legs covered.
We're checking the kids for ticks every day.
Thank you, Dr. Kritzkes. Great to see you.
Thank you.
Same here. You're very welcome.